Stop walking the way you were taught to walk. I know that sounds insane coming from a doctor, but the walking habits you picked up decades ago may be the exact reason your balance is failing you now. I'm Dr. James Carter, and in 22 years of orthopedic and geriatric practice, I have watched thousands of falls happen, and I can tell you, almost none of them were accidents. They were predictable, preventable, and in most cases, the warning signs were showing up months, sometimes years, before the fall itself. Here's the number that should scare you into paying attention for the next 10 minutes. Adults over 65 experience millions of fall-related injuries every single year, and 1 out of 5 of those falls results in a serious injury like a fracture or a head trauma. Falls are the leading cause of both fatal and non-fatal injuries in older adults. That's not a scare tactic, that's the reality doctors like me deal with every week in the clinic. But here's what almost nobody tells you. The solution isn't be more careful. Being careful doesn't rebuild the muscle, the reflexes, or the inner ear function that actually prevents a fall. What does that is a specific set of walking-related habits, and one of them, which I'll cover as number 2 on this list, actually reverses fall risk in a way most seniors have never even heard of. So stay with me, because by the end of this video you'll understand exactly why your grandmother's cane advice is outdated and what to do instead. Before we get into it, I want to ask you something. And I genuinely read every single comment on this channel. So tell me down below, how old are you right now? And has a fear of falling ever stopped you from doing something you used to love, like gardening, dancing, or just walking to the mailbox without holding on to something? I read these every day, and honestly, they shape what I cover in future videos. So don't be shy. All right, let's count it down. 6 to 1. Least powerful to the single most important walking secret I know. Stick around for number 1. It's the one thing most doctors never explain properly, and it might be the single biggest factor in whether you're walking confidently at 85 or not walking at all. Number 6. Your shoes are quietly sabotaging your balance. I had a patient, Ruth, 71 years old, from a small town outside Sacramento who came into my office after her second fall in 4 months. Both falls happened in her own kitchen. When I asked to see her house shoes, I understood immediately worn-down soles, no arch support, and a heel that had compressed unevenly on one side. Her foot was literally sending her brain the wrong signals about where the ground was. Here's why this matters so much for aging bodies specifically. The soles of your feet are covered in pressure sensors that tell your brain, in real time, exactly how your weight is distributed and whether you're tipping forward, backward, or sideways. This is called proprioception. Think of it as your body's internal GPS. As we age, and especially after 70, that GPS signal naturally weakens due to nerve degeneration, and worn-out or overly cushioned shoes make a weak signal even weaker, essentially putting static on the line between your feet and your brain. The fix is simple but specific. Choose shoes with a firm, thin sole rather than thick, spongy spongy soles feel comfortable but actually blunt the pressure signals your brain needs. Look for a wide toe box so your toes can spread and grip the ground naturally, and make sure the heel height is consistent between your left and right shoe, since even a small mismatch changes your gait pattern. Replace walking shoes every 8 to 12 months if you're active, because the support breaks down long before the shoe looks worn out on the outside. For synergy, pair new shoes with a simple habit. Stand barefoot on a folded towel for 2 minutes each morning, gently rocking side to side. This wakes up those foot sensors before you even put shoes on, so your brain starts the day with clear signals instead of static. Number 5. Your house has a hidden fall trap you're walking past every single day. Frank, 78, from a suburb outside Cleveland, fell at 2 in the morning walking from his bedroom to the bathroom. Nothing was on the floor. No rug, no cord. What tripped him was the transition strip between his carpet and his tile, a 1/4-inch lip he had stepped over successfully for 15 years, until his depth perception in low light changed. This connects to something most people don't realize. Your eyes need dramatically more light to see contrast clearly as you age. By the time we reach our 70s, many people need roughly 3 times more light than they did in their 30s to perceive edges, steps, and transitions with the same clarity. In dim light, your brain essentially guesses where the floor is, and after 75, that guessing game gets far riskier because your reflexes for catching a stumble slow down substantially. The practical fix. Install motion sensor night lights along every path you walk in the dark, especially bedroom to bathroom routes, and mark any floor transitions with a strip of contrasting tape. Keep a lamp within arm's reach of your bed rather than relying on an overhead switch across the room. Do a 2 a.m. walkthrough during the day. Literally walk your nighttime route with the lights off and your eyes adjusted, so you can find the hazards before your body does. The synergy tip here is pairing better lighting with a brief pause and orient habit. Every time you stand up, especially at night, pause for 3 full seconds before taking your first step. This gives your blood pressure and your inner ear time to catch up, which brings us to something even more important. Number 4. The dizziness you've been ignoring isn't normal aging, it's a warning system. Before we go further, if this information is landing for you, hit subscribe and tap that like button. It genuinely helps this channel reach more seniors who need this exact information. And it costs you nothing. Okay, back to it. Margaret, 69, from a small coastal town in Oregon, told me she'd get a little woozy whenever she stood up too fast. She'd been living with this for 3 years, assuming it was just part of getting older. It wasn't. It was a treatable inner ear and blood pressure issue that was actively increasing her fall risk every single day she ignored it. Here's the science in plain terms. Your inner ear contains a structure that acts like a spirit level in a construction tool. It tells your brain which way is up. With age, the fluid and tiny crystals in that structure can shift or degrade, a condition sometimes called benign positional vertigo. At the same time, blood vessels lose some elasticity, so when you stand, blood pressure can dip suddenly, a condition called orthostatic hypotension, before your body corrects it. Combine a wobbly inner ear signal with a temporary drop in blood flow to the brain, and you have the exact recipe for a fall. The fix isn't complicated, but it requires consistency. Stand up in stages, sit on the edge of the bed or chair for a count of 5, then stand and hold on to something solid for another count of 5 before walking. Get your blood pressure checked both sitting and standing at your next doctor's visit. This simple test catches orthostatic issues that routine checkups often miss. If dizziness is frequent, ask specifically about vestibular rehabilitation therapy, a set of guided head and eye exercises that retrain your inner ear's signal over just a few weeks in many patients. Pair this with hydration as your synergy tip. Mild dehydration thickens the blood slightly and worsens blood pressure drops. So a glass of water, first thing in the morning, before you even stand up, meaningfully reduces that dizzy, unsteady feeling for many people. Number 3. Your muscles are aging faster than they need to, and most seniors don't know why. Walter, 74, from a farming community in Iowa, told me he simply couldn't get up from a low chair anymore without pushing off with both arms. He assumed this was inevitable. It's not. It's a specific, well-understood process called anabolic resistance, and once you understand it, you can work around it. Here's what's happening in your body. Muscle tissue is constantly being broken down and rebuilt. Think of it like a delivery truck constantly dropping off building materials at a construction site. In younger adults, a small amount of protein triggers a strong rebuilding response. But after roughly age 60, and more dramatically after 70, your muscles become resistant to that signal. The delivery truck shows up, but the construction site barely responds unless you send a much bigger delivery at once. This is anabolic resistance, and it's a major reason muscle mass and leg strength decline with age, which directly weakens the muscles that catch you when you stumble. The fix is twofold. First, protein timing matters more than most seniors realize. Rather than spreading small amounts of protein evenly through the day, aim for a larger concentrated dose, roughly 25 to 35 grams at each meal, since this larger delivery is what actually triggers rebuilding in an aging body. Second, and just as important, pair this with resistance movements that load your legs, specifically sit to stands from a chair, wall pushes, or step-ups on a low stair, done in short sets several times a week. For synergy, do your resistance movements within an hour or two of a protein-rich meal. The muscle-building signal and the raw material arrive together, which appears to amplify the rebuilding response far more than either one alone. Number 2. This one exercise retrains your brain to prevent falls before they happen, and almost nobody prescribes it properly. This is the one I promised you at the start. Dorothy, 81, from a small town in North Carolina, came to me terrified after a near fall on her porch steps. Within 10 weeks of a specific practice, she was walking her neighborhood loop again without a cane for the first time in 2 years. What changed wasn't her strength alone, it was her balance training, specifically single-leg stance work and multi-directional stepping practice, sometimes grouped under the term dynamic balance training. Here's why this matters so much for aging bodies. Balance isn't one skill, it's your brain constantly integrating 3 streams of information: what your eyes see, what your inner ear senses, and what your feet feel on the ground. The proprioception we talked about earlier. As we age, all 3 streams weaken somewhat, but the real danger is that the brain's ability to quickly integrate and react to conflicting information, say, your eyes see a step, but your foot feels uneven. Ground slows down. This is sometimes described as reduced postural reflex speed, and it's a major independent predictor of fall risk, separate from muscle strength alone. The practice is simple to describe, but powerful in effect. Standing near a countertop for safety, practice holding on one leg for 10 to 15 seconds, alternating sides, working up to doing this without holding on once you feel steady. Add stepping practice, small steps sideways, backward, and in a slow figure 8 pattern a few times a week. This isn't about building bigger muscles, it's about retraining the speed and accuracy of your brain's balance reflexes, which studies on structured balance training in older adults consistently associate with meaningfully reduced fall rates over several months of practice. The synergy tip: do this balance practice with your eyes open first. Then, once confident, try brief moments with your eyes closed while holding on to something solid. Removing vision temporarily forces your inner ear and foot sensors to work harder, strengthening the exact reflexes that save you during an actual stumble. And now, number 1, the single most powerful walking secret, and the one that ties every other item on this list together. Number 1. Your walking speed is one of the most accurate predictors of how many more years of independent living you have left, and almost no doctor tells patients this directly. I'll be honest with you, this is the finding that changed how I practice medicine. Researchers who study aging have found that simple walking speed, how many feet you cover in a set number of seconds at your normal pace, correlates strongly with overall health, hospitalization risk, and independent function in older adults. It's sometimes informally called a vital sign of aging, because it reflects all at once your cardiovascular health, your muscle strength, your balance, and your neurological function. Here's why this single measurement is so revealing. Walking is actually one of the most complex things your body does. It requires split-second coordination between your brain, your inner ear, your muscles, and your cardiovascular system, all firing correctly dozens of times per minute. Think of it like a factory assembly line. If any single station on that line slows down, even slightly, the whole line's output, your walking speed, slows down too, often before you consciously notice a problem in any one area. That's why a slowing gait frequently shows up months before a fall, before a diagnosis, before anything else. The good news is that walking speed is trainable, and improving it improves everything connected to it. Here's the practical approach. Once or twice a week, practice interval walk at your normal comfortable pace for 3 minutes, then walk as briskly as you safely can, with good posture for 1 minute and repeat this cycle 5 or 6 times. This isn't about becoming a competitive walker. It's about periodically challenging your cardiovascular and neuromuscular systems to adapt, the same way lifting slightly heavier weights builds strength. Just as importantly, practice what's sometimes called dual-task walking while doing something mildly mentally engaging, like counting backward from 100 by threes or naming items in a category. This feels strange at first, but it directly trains your brain to maintain balance and gait control even while your attention is divided, which is exactly the real-world situation: checking your mail, watching for a curb, thinking about your grocery list that causes many falls in daily life. For synergy, combine this with everything else on this list. Better footwear gives your brain accurate ground signals. Better lighting removes visual guesswork. Managing dizziness keeps your blood flow and inner ear steady. Adequate protein and resistance training keep your legs strong enough to respond. Balance practice keeps your reflexes fast. And walking speed training ties it all together into one measurable habit you can track, meet after meet, month after month, and actually watch improve. All the research I've referenced today, along with more detailed explanations of each exercise, are linked in the description below, so you can look into the specifics yourself and bring anything relevant to your own doctor. I want to leave you with something before you go. Independence isn't just about avoiding a fall. It's about being able to walk into your grandchild's birthday party without a second thought, to garden on a Saturday morning without fear, to get up in the middle of the night without holding your breath. Every single person I've mentioned today, Ruth, Frank, Margaret, Walter, and Dorothy, started exactly where you might be starting right now. A little unsteady, a little worried, maybe already having had one fall too many. And every one of them found their way back to confident, independent walking. Not through luck, but through small, specific, consistent changes. It is genuinely never too late to rebuild your balance, your strength, and your confidence, no matter your age today. If this video helped you, please subscribe to the channel I put these out, because I believe every senior deserves to age with strength and independence, not fear. And I want to hear from you in the comments. Which of these 6 secrets was completely new information to you, and which one are you going to start with this week? I read every comment, and I'll see you in the next video.